Sahadulla sir is our beloved legendary leader and he has taught us so much. The white paper that we hope to discuss is his brainchild. We had a discussion at Trivandrum. So we'll briefly listen to Sahadulla sir and we'll take it forward in the panel. A warm welcome to Sahadulla sir, please.
Good afternoon to everyone. Thank you very much. Devin, I think, is taking a lot of responsibility in organizing this for the last few weeks. His reminders, his messages. How do you do that? No, it's all right. And all that had been very helpful, and I really appreciate you and your team for organizing a good meeting here today. And I see a lot of my friends, Dr. Prabhakar, it's nice to see you after several years, and also Vice Chancellor Mohan and all our hospital friends here, Haridas and Dr. Ashok. So, SK Shivankuti, all of you, and my classmate, baby is here. So I think I will take only a few minutes. I think my subject has been very, very covered well by the previous speakers. If you look at the patient centricity Dr. Haridas was talking about, if you look at the crisis management Mithun was talking about, and I think Advaita and Aditya were talking about the professionalization of family business or how to do the family business. All that, so one answer is you need to build the teams. And to achieve all that, team building is the most important. And which obviously tells you that team building is not easy. Even to build a team among the family, I think Aditya put it as very nicely, and it looked very easy, but in my experience, it's not very easy at all. So the only one thing I differ is from Ashokan. The team should consist of all ages. You wanted to hand over everything to the new generation and youngsters. It's a question, who is the young and who is the older? And is it a number, or is it a psychological, or is it a physiological aging? Or is it a spiritual aging? I'm not quite sure. So I think a combination of the factors is always the most important in team building. And I have a couple of slides. I will just go through it quickly. And how do I move the slide? Do you use this or you move it? Yeah, can I have the next slide? If you move it. Oh, this works. Left is going forward. Right is going down. Thank you. All right. So team building is pretty difficult, as I said. But there is one person and required for all this. What all of my previous speakers were talking about is their leadership. So that leadership character has to be, come in, and that will guide most of the impact and the end results. If you look at it for leadership, as Advaita was saying, or, okay, you need an inherent leadership quality. Perhaps some of the MBAs and other training programs are very important, because if you look at it, one of the failures of Indian Administrative Service, IAS and all, if you look at it, and they don't have a proper training in management. They have some intensive courses and all that, and then they become a master of every art and probably a leader of nothing and leader of none. And so if you think that Government of India has started sending senior IAS officers to various courses to Oxford and Harvard and all that recently. So I think a proper training program, like in sports, we are advancing now in sports because we have got better coaches, we have got better trainers, and the same thing is applicable in management too. And so that's the most important thing. And members of the team can be between hospital association is a team. In fact, QPMB is discussing that how we can bring associations under the same umbrella, and that's a team. So I think so the team should have everything: the good, the bad, the ugly, and all people should be there. And to make them a synergy, I think the leader should be either you can lead from the front or you can lead from the back, as Nelson Mandela says. And that's the kind of a leader, team building we need. A couple of things I'll say that, doctors in management is an important for healthcare. If you look at doctors, I don't know how much in India, but generally the statistics say only about 10% of the people in management are doctors. And my philosophy is always that more and more doctors should come into management. Why not? Because we have the capacity for decision making. And many times we are all have to take the decision making at a point of time. We have to solve a problem also in few moments. And you go to a diagnosis, you start a surgery, and immediately you decide that probably they should be done the other way, and so that problem solving happens pretty fast. And so in every aspect, intelligence-wise and all that, doctors are gifted to become leaders. The only thing they lack is perhaps training and perhaps a bit of out-of-the-box thinking. And that happens not only in management. If you look at the whole problems we face in healthcare today, and many of those is that the changes have to happen. It can be digitalization, it can be AI, or it can be otherwise. But the changes have to happen, and that change management has to happen. And so it is easy to talk the theory part of it. I can stand here and talk for hours, but it's difficult to do it. And that is where perhaps we should focus, not only hospitals, but healthcare community in general. Just an example, because let us say that I'm more focused on medium and small hospitals. I have the privilege of having a bigger hospital management, and probably team building is not difficult. I can get a bigger team and all that. But what I'm saying is that medium and small hospitals, which is mostly represented by QPMB, BA, and they should focus on irrespective. See, for example, today violence against doctors is a problem. And when we face a difficult case and go to address a patient or their relatives about what we are going to do or what we have done and unfortunately gone wrong, and the doctor concerned or attending doctor should not go alone. And the doctor should have definitely supported by the management. And there should be other people, other specialties, doesn't matter. It can be an internist problem, a surgeon's problem, but a pediatrician can certainly be there and support him. So that teamwork will take away a lot of problems, and the question can be answered better and better. What happens nowadays is that, one person goes or two people go and have a confrontation with the patient. And then another, the nurse leader should be there in the team. And so what happens is that somebody in the hospital talks about, oh, it could have been done better like this. So that team building and buying people in does not happen in healthcare as much as it should happen. And in my view, that's one of the root cause analysis what was being done. And the root cause analysis shows that that can change a lot of the perception of the community, the media, the polity, the social scientists. All of them will change the views about us. So I think that's what. I don't think this matters. We should communicate well. Yeah, probably a little bit. Communication is the one. I talked about coaching. Communication is an art. And I'm a membership examiner and MRCP. And one of the things in communication, we always look at the candidate is that whether he is honest, whether he has the integrity, and whether he keeps up confidentiality. And so there are characters and which we look at a communication. And our doctors, I think there are excellent communicators, but we need training for proper communication. And that will improve our image quite a bit with the patients, with our customers, with our guests, as well as with the community. A lot of teams you can build it, so there is any number of examples. See, for example, we are a commissioning team. In the commissioning team, we have a new hospital we are building, and we have got a commissioning team, and we even include the supervisor of the janitorial service. Leave alone the nursing, everybody will be there, quality, ID, infection control. But even up to, if you have taken cruises in the various big cruises, the first person who will be introduced and when they welcome us is the captain. And the second person is the head of the janitorial service. Do we give enough importance to those people? And probably we are not. And do we give enough importance to our nursing leader? And probably not enough. So we have to empower those people, and that will be a good team building activity. A lot of teams can be built, and I'm not a theory person. And some of the challenges, of course, is worth mentioning. And, develop trust. And that is where we, again, have got to improve with the patients. We try to hide. There's an open disclosure. Probably we had to stop a surgery on the way, and because he had an allergy or because anesthesia was not proper, or he had a problem, or he had anaphylaxis. And but how many of us come to the patient and say, not the patient, their relatives, and say that we have to stop the surgery because of the reasons. And that open disclosure rarely happens, and the open disclosure will certainly, it will give some infirmity and the immediate period, but on the long run, I certainly believe that that kind of an open approach, transparency, will take you a long way, and they will start believing you. trust. So if there is a iatrogenic complication, we have to, we do a lot of complex procedures, and I had a number of iatrogenic problems in our hospital, and I have even visited their houses, and faced their criticism very openly, and had opportunities to discuss with the family what has gone wrong, or what they perceived it as wrong. And I think immediate criticism might have been there, and I always feel that it has proved dividend in the long run. And in the team, always take a critique. In the board, I had a director of the board who was always critique of me. Whatever I do, he will critique. So I have to reconstitute the board. And what I did was that many friends, I did not take it back, but I took the critique back. And today, he is one of the best friends in the board, and also he does a very productive, creative criticism, and I benefit out of it. So I think there should be all kinds of people in the team and the critique. I don't want to go with all that, and I want to say that team building is an art, and I really feel a lot of it has been covered by the previous speakers, and we, especially building team in the family, professionalization, and variety of people being in the team, but leadership is the most important. This is more so in healthcare, but irrespective of healthcare or any other industry or business, team building is an important art we all have to practice. And what advantage we get is the synergy, as Mark Twain said, is a byproduct of it. And even after AI and even after all the developments in the, the people will make the difference. And so I think that's the message I have for you. Thank you very much for your patient listening. Thank you.